Hi everyone. Okay, so I wanted to show you on a model correct film placement. So I have the posterior XCP holder set up right now, and I'm going to show you film placement for the premolars as well as the molars. So keep in mind that this would be the same placement for your horizontal bite wings as well that we were talking about. So we're going to aim for distal of the 3, the canine, and then for our molars, we're going to aim for distal of the 5. And these are just some kind of tips and tricks along the way. So starting in the premolar area, the client obviously wouldn't be opening this wide, but that would be amazing if they could. Woo! But I just need to hold it open so that you can visually see. So you would want to place the film in the mouth and then down into the floor of the mouth here. So a lot of the times I have to actually slide the film across the tongue and then drop it down into place, just depending on how the tongue is acting that day. So I want to keep the film, try to hold that up a little bit closer for you. I want to keep the film as straight and parallel as I can to the teeth, because when we're talking about overlapping, yes, overlapping can occur when the PID is not correct, so the horizontal angulation is off, but also if you placed a film in someone's mouth and it was twisted like this or like this, you're going to get overlap. So make sure, first things first, that your film is nice and straight and parallel to the teeth that you're radiographing. And then for the premolar area, I always make sure that the front edge of my film, so right here, is as far forward on the floor of the mouth as I can get it. And then from there, I know that I'm covering the premolar area, but if I don't do that slight rotation towards the canine, this is where I will miss the canine altogether. So again, down into the floor of the mouth, and make sure that your film is nice and straight and parallel to the teeth, and then make sure that that film is pulled as far forward as you can. From there, I'm going to do a quick little rotation like this, a slight rotation, so that the front edge of my film is now behind the distal of the canine. And this is where I'm going to hold my film nice and steady and ask my client to slowly bite for me. And that will ensure that I have the distal of the canine. For the molars, we don't have to worry about this curvature in the arch. Obviously, we're a lot more flat back here. So down into the floor of the mouth, and make sure that the front edge of the film is behind the distal of the 5 this time. Keeping in mind that when people close, the jaw is like a hinge. So the film sometimes wants to push forward or sometimes push back. So we really have to have a good hold on our XCP holder or our snap array, whatever technique you're using, to make sure that that film doesn't slide forward or backward on you. I literally have my eyes locked on this film placement until those teeth come together on that bite block. So I want to stabilize it there and make sure that my film placement doesn't move on me and that it doesn't twist either. Another little trick that I want to show you is for the mandibular, whether you're doing the premolar or the molar placement, before the person is, so you have your positioning, you're happy distal of the 3 or distal of the 5 like we were just talking about. And now just to make it easier for this client to close, this is where it usually hurts them. So right now the film is too close to the teeth and too close to the ridge, like the bony ridge, the arch there. So as the person is closing, I'm going to say, okay, you can now slowly close. I'm actually going to push back on the tongue a little bit like this, so that the film is more so in the center of the mouth, and then it will be so much easier for them to close. Your clients will love you.